Hello, everyone, and thank you so much for joining us today. I'm Isra Pananon-Weeks, Interim Executive Director and Chief of Staff at the National Asian Pacific American Women's Forum. On behalf of NAPAWF and our guest speakers, it's my pleasure to welcome you to our community briefing 1 year after Dobbs, Abortion Access for Asian Americans and Pacific Islanders. It was 1 year ago, on June 24th, that the United States Supreme Court made the reprehensible decision to overturn the constitutional right to an abortion established by Roe v. Wade. This decision upended nearly 50 years of legal precedent. It further emboldened states to enact their own abortion restrictions and bans that disproportionately jeopardizes the health, safety, and economic stability of working poor, low-income communities and people of color. Within Asian American and Pacific Islander communities, 35% of pregnancies end in abortion. Abortion access is and always will be a critical part of our reproductive lives. Yet even before Roe was overturned, the path to getting an abortion for many in the AAPI community was marked by cultural, economic, and systemic barriers, including language barriers, deep cultural stigmas, and low rates of insurance. And since Dobbs, women of color, including AAPI women, continue to be disproportionately impacted by the end of Roe and abortion bans. AAPI women are overrepresented in low-wage workforces. We, including our mothers, aunts, cousins, and extended family members, work on the front lines every day as restaurant workers, retail workers, salon workers, and personal care aides. Often, this work gets done without a living wage and without paid medical or family leave. For the 22 million Asian Americans in the United States, 1/3 of low-income Asian women live in a state where abortion is banned or severely limited. For these women, it is difficult, if not impossible, to have the resources to take time off from work to travel out of state for an abortion. I would also like to take a moment to recognize the Biden-Harris administration for supporting women's access to the full range of reproductive health care options and services that are available, and who just last week signed an executive order promoting greater access to contraception, including over-the-counter contraception, while continuing calls to protect abortion access. NAPAWF is grateful for the Biden-Harris administration and others in leadership positions who believe in and advocate for reproductive freedom. On this exact date last year, more than 700 attendees joined us for our community briefing after the Supreme Court's decision to upend abortion access in this country. Last year's briefing, just like the one today, is a critical reminder of the need for more conversations that center the experiences of Asian American and Pacific Islander communities. So today, a year later, we continue to reflect on the ongoing impact of the Dobbs decision on AAPI communities. For this conversation, I am so grateful to be joined by an amazing lineup of speakers who will offer their unique perspectives on the past year, as well as how we can contribute to move forward. We will also have time at the end of this for Q&A from the audience. If you have any questions, please type them in the Q&A window, not the chat function. We'll do our best to answer as many of them as possible during the Q&A period. Today's briefing is also being recorded and we shared out to our email listserv. So if you're not already signed up to receive our updates, please visit napawf.org/together. And with that, I'd like to welcome our first special guest and first speaker, Minnie Timaraju, President of NARAL Pro-Choice America. It will be very difficult to distill Minnie's storied career into a short introduction, but I will do my best. So Minnie has more than 20 years fighting for reproductive, racial, and gender justice. She has worked in and with diverse communities and constituencies, including time spent in governmental and political spaces. Minnie is a multi-talented campaigner, coalition builder, organizer, and respected leader with a long-standing commitment to the fight for access to the full range of reproductive health care. A first-generation Indian American, she is the first woman of color to lead NARAL. And I am so pleased to add that we are fortunate enough to have Minnie serve as on NAPAWF's board. So thank you so much, Minnie, for joining us today. And your first question is, I'll just go ahead and tee it right up here. So you took your leadership position with NARAL 1 month before SCOTUS heard oral arguments in Dobbs and have really been at the forefront of the movement while this case and everything that has followed has played out. We would love it if you would share your thoughts and insights into the current state of play for abortion access across the country.
Thanks, Isra. And for purposes of today, my number one identity is NAPAWF sister. So excited to be here with all of you. Really proud to be able to be in this fight with the leadership and all of the staff and all of the NAPAWF members across the country. 1 year since Dobbs, it's pretty wild, right? You have to take a step back and think it's been a year since Roe ceased to be law of the land. I'm 50 years old. Roe has been the law of the land my entire life. And I am now raising kids who will have fewer constitutional rights than I did, which is really shocking. And then you couple that with today's really devastating affirmative action decision and how it impacts AAPIs. It's a dark day for us, right? There's been a lot of dark news from this court. The state of play, just for folks who may not be paying attention week by week with everything going on with abortion. We have 20 states with some form of restriction or ban on the books in this country. We have 22 states plus the District of Columbia with some sort of abortion access protection. And this is really important. So while we have big swaths of the country that are abortion deserts, frankly, and mostly through the South, we also have some states that have done really critical work to immediately expand and protect access. And I say that because as I travel across the country and I talk to NARAL members, and we're in all 50 states with 4 million members, it's important to make sure we're talking about the stark reality of what's happened post-Dobbs. We're also giving people hope and a pathway to win back these fundamental rights, right? Because the news is so dark and so difficult, we've got to make sure our members and our supporters understand the pathway to win back our fundamental freedoms. The other positive thing I'll note post-Dobbs, it's like, look, the panelists that I'm on with are going to tell you some really horror stories. They're getting more and more dystopian by the minute, frankly. Stories of folks with later term pregnancies who are in sepsis, folks who are dying, folks who are, immigrants or undocumented, unable to leave their states because of state restrictions, fear of prosecution, doctors who are unable to practice medicine ethically anymore and are leaving states, closing down hospital systems, closing down access to abortion care and reproductive care and general health care in big parts of the country. So the consequences have been dire. What I want to say is that since Dobbs, there's been an uptick in activism in all of our communities on abortion rights, and that's an important thing to note. There's been an uptick of public perception and a support for abortion. We are now at a 83% threshold of support in the United States for abortion access. This is a nationwide high. That includes a slim majority of Republicans and a significant majority of independents. So as we're doing our organizing work and as we're mobilizing together around all of our community work and working with legislators and policymakers to make sure they're enacting the most expansive protections possible, we know that we have public opinion on our side. And the other big thing that's happened post-Dobbs is the believability gap has closed. NAPAWF, NARAL, all of our partners in the reproductive rights and health and justice coalitions have been raising the alarm since Planned Parenthood v. Casey that Roe was always the floor, not the ceiling. And what we meant by that was Roe provided essential fundamental protections, but that the access to abortion was the critical piece missing for women of color, marginalized communities, limited English proficient communities, immigrant communities, et cetera. And AAPI sit squarely in the intersections of many of those identities. So for our communities, even with Roe in place, we were facing abortion access crises. And our groups have been shouting from the rooftops about this for decades. Now that we're in a post-Dobbs environment, most Americans, the majority, as I said in those polling numbers, understand that abortion is healthcare, understand that abortion is a critical issue, and are adamantly opposed to a nationwide abortion ban. That is really important because that is what we're fighting against at the federal level, but it also helps us make the case in state legislatures and beating back some more nefarious laws. Now, the downside, again, that I'll share as I wrap up my comments is The 20 states with abortion bans happen to be some of the states with the highest percentage of AAPIs and the fastest growing percentage of AAPI voters. So we're talking about places like Georgia and Texas, my home state of Texas, where we have growing populations, rising American electorate, margin makers in elections in really tough states that have complete bans, that have also dramatically restricted voting rights in those states and have terribly gerrymandered state legislatures. We also have a Supreme Court that is dominated by extremists, which is why we recently in NARAL have taken up the issue of court reform and court ethics, and we're advocating for court expansion. Happy to answer more questions about that. I think I'm at my time, but that is sort of the scope and the state of play for abortion access in the country post Dobbs. And it's mostly horrific. But if there can be a silver lining, it's that more Americans than ever are with us, and that includes AAPIs.
Thank you so much, Minnie, for just sharing some polling numbers, but also the statistic that 83% do believe in us having our reproductive rights, and that's definitely a positive thing, despite the grim landscape that we're facing. So
we certainly didn't want it to happen as a result of Dobbs, but here we are.
Yeah.
And what I'm saying is, now that we're here, we have a moral obligation to finish the job and to get legislation passed at the state level and the federal level to protect our communities.
Well, we definitely appreciate hearing that, and obviously have more questions for you. So we'll welcome you back when we get to the Q&A. All right. So our next speaker is a proud Asian American feminist, scientist, and self-proclaimed nerd who has been bringing public attention to issues impacting Asian American Pacific Islander communities for many, many years. She is a strong and constant voice for racial and gender equity, and is the founder and co-editor of Reappropriate, one of the web's oldest AAPI feminist and race activist blogs. It is my pleasure to welcome Jen Fang to the screen. She's already up. And I will, just like Minnie, go ahead and shoot straight from the hip and offer you your first question. So Jen, you wrote and published an important piece last year in Prism, right before the Dobbs decision dropped. And that piece highlighted the connection between disaggregated data and the fight for AAPI abortion care. So truthfully, it's a piece that we at NAPAWF return to and reference pretty often. So the question is, what inspired you to write that piece? And can you share what you consider the major takeaways? What do people need to know? What do you need people know? And has your understanding of the issue changed now that it's 1 year past the Dobbs decision?
Thank you. And thank you to everyone for having me here. And I also want to thank all of the attendees at today's event for prioritizing this issue within our communities and our advocacy. So it was really important to me to take some time to write this piece about abortion and access and reproductive justice in the AAPI community, because, you know, in a large part of my advocacy, one of the things that I really want as a message to get out to our communities is that reproductive justice is an AAPI issue. And what I mean by that is that I want us to reframe this fight both from a context of how reproductive justice issues can better include AAPIs, but I also want us to reframe the way we think about AAPI racial justice as something that needs to include abortion access as a major advocacy priority. And the reason why I believe that we need to fundamentally communicate that message that reproductive justice is an AAPI issue is first and foremost because it is something that impacts our community. If we look at who uses abortion care services, we find that roughly 6% of them are Asian Americans, which means that we are represented within the patient population that takes advantage of abortion care services. We are part of the people who need abortion access. And it turns out that even pre-Dobbs, the vast majority of our community, 3/4 of them, supported abortion access within the United States. And so this is something that our community, we use those services, we need those services, and we understand that we need those services. And yet we as a community, both as Asian American and Pacific Islander advocates, as well as reproductive justice advocates, rarely talk about how this is an issue that affects the AAPI community. And as we think about how this is reproductive justice is an AAPI issue, I also wrote the article because I wanted to really dig deeper into how reproductive justice issues impacts AAPIs. So like I said, many folks within our community use abortion care services, but we also need to consider how abortion in access affects our community with regard to the diversity and heterogeneity of our community. And so one of the major messages I wanted to communicate through my piece was how we need to sort of disaggregate what we understand about how AAPIs intersect with the reproductive justice issues so that we can better reflect the diversity within our community. So for example, when we think about abortion access attitudes, we can say, you know, broadly speaking, most Asian Americans support reproductive rights, but that does vary across ethnicity, and that can reflect the differing sociopolitical contexts and cultures that fall within the larger umbrella of the AAPI community. And so we can also think about how you know, socioeconomic issues or classism can affect how different AAPIs access and need access to abortion care services. AAPIs have one of the largest, if not the largest, wealth gap of any racial group. And as was mentioned earlier, there are many AAPIs who are low wage or service workers who really rely on strong access to abortion care through, you know, many different clinics that service low wage or low income communities. And so when we are talking about just how you know, Dobbs is affecting abortion care access with regard to impacting people who are lower income, those are going to be affecting in particular the many aspects of the AAPI community who are also lower wage or service workers. And we really need to visibilize those impacts specifically in the AAPI community. The other thing I really wanted to talk about in that article was how just the different factions who are talking about reproductive justice are intersecting with racial justice, right? So like anti-abortion activists are communicating a message that too often, especially on the state level, relies on anti-Asian rhetoric in order to communicate those anti-abortion messages. They draw upon stereotypes that, you know, link to perpetual foreigner stereotypes or model minority stereotypes. And that is really a racial justice concern, right? So like, as we think about how we can participate in this fight, we should be framing the reproductive justice issue as also a racial justice issue, because it perpetuates many of the racial stereotypes that impact the AAPI community. And lastly, with regard to impact, I really wanted to highlight specifically the very invisible aspects of our component or subpopulations within our community, which is Pacific Islanders, and how PIs in particular really are going to lose a lot of access, especially in a post-Dobbs world. And that's, you know, for folks living in Guam or other Pacific Islanders, they basically don't have access to local abortion care services. And this is only getting worse in a post-Dobbs world. And so one of the aspects of my article was to really highlight how Pacific Islanders, even pre-Dobbs under Roe, didn't have really great access to abortion care services, and it's essentially non-existent at this point because clinics are not available where many Pacific Islanders live. And so just to sort of bottle the answer and talk about what my take-home message for that article was, really what I was hoping to do was to activate both the AAPI community as well as the reproductive justice advocacy communities to collectively work on this issue of reproductive rights and reproductive justice with AAPIs in mind who are impacted by abortion in access in our country.
Thank you so much, Jen. I feel like you said so much in such a little time frame, and so I do want to highlight some things. I think, you know, you might be a headliner over NAPAWF next campaign. So I think what you said was so important. Reproductive justice is an AAPI issue. I think that's worth saying over and over again because some people don't think of it as so. You know, you also mentioned a lot about just the living wage and economic justice. In NAPAWF, we say, you know, we don't live single issue lives, right? So we cannot have reproductive justice without pay equity and a living wage. So thank you for mentioning that. And of course, disaggregated data. We will continue to push and advocate for disaggregated data for many of the reasons that you offered here. And thank you again for mentioning so many key points. And we'll see you at the end of the program for the question and answer. All right. It is my pleasure to welcome our next guest speaker, Shivana Jorawar, I guess a co-New Yorker of mine, who's also a founding member and co-director of the Jahaji Sisters, a gender justice organization based in New York that advocates for Indo-Caribbeans to put an end to intimate partner, family, and sexual violence. She's a lawyer and seasoned policy advocate, organizer, and proud abortion storyteller with the We Testify project. We're also grateful for more than 4 years Shivana spent directing reproductive justice priorities for NAPAWF. So yes, she's also a NAPAWF alum, in addition to her roles with the Center for Reproductive Rights and the National Abortion Federation. Thank you so much for joining us today, Shivana. And as I've been doing with our other guests, I'm just gonna dive right in and go straight to the questions. So as we've been discussing today, barriers to access or lack of abortion care have serious impacts on AAPI communities. Can you share with us the implications that abortion restrictions and bans can have for people experiencing intimate partner violence, domestic violence, and other forms of gender-based violence?
Of course, Isha, and thank you so much for having me. I'm really excited to be having this very important conversation at such a critical moment, and grateful for everyone who is attending and taking time out of their day to memorialize the end of Roe versus Wade and talk about how we can take action too, which is really important. And as someone who grew up with the right to abortion being the law of the land, similarly to Minnie, someone who's had an abortion, and frankly, someone who may need an abortion in the future, what the Supreme Court did in Dobbs and all of the anti-abortion politicians who made Dobbs possible absolutely infuriate me. And this issue is not only important to me, as was shared earlier, we know that it's important for our whole community. 41% of South Asian voters in Texas name abortion rights among their top issues that they believe Congress should prioritize. We know that 68% of Hindus and 55% of Muslims in America believe abortion should be legal in all or most cases. And in Sikh American communities, 59% of people have either had an abortion or they know a Sikh person who has had one. So thank you for making a space for Asian American voices on abortion access to be lifted up. This is very important for us. And, for me, one of the most devastating things about the fall of Roe is that bans on abortion are just one more tool for abusers to use in their efforts to exert power and control over their partners. We know that people who abuse often force their partner to get pregnant and give birth through preventing abortion care, through sexual assault or coercion, or by sabotaging birth control. So pregnancy and children can be used as reasons for the survivor to stay in an abusive relationship, and children can be used as a way for abusers to stay in contact with the survivor even after the relationship has ended. For example, one woman I worked with, she was terrified to take her daughter to a doctor because the child was covered under her ex-husband's health insurance. He had refused to remove her from his plan, and it became a way for him to track her and her mother. So if the insurance was ever used, he would see information that would help him find them. So you can see pregnancy and children are used as ways to tether a survivor to her abuser in many cases. And the Supreme Court just made that even easier to do. And we know from a really excellent study called the Turnaway Study that women who were denied abortions were more likely to experience violence because of this kind of ongoing contact. And there's also data to show the connection between abortion access and intimate partner violence in the South Asian community. So in a study of South Asian women, it was found that approximately 39% of folks indicated there was an unwanted pregnancy in their abusive relationship, due to a lack of sexual and reproductive control. That is a big number, and it should concern us. Pregnancy, we know, can also increase the risk of violence and death for folks who are experiencing intimate partner violence. In the US, homicide is actually the leading cause of death among pregnant women. And one study found that a woman's odds of experiencing IPV, intimate partner violence, rose by 10% with each pregnancy. We also know that between 6% to 22% of women terminate their pregnancies because they're in an abusive relationship, and 34% of survivors say that their abusive partners have limited their childbearing decision. So too often, violence at pregnancy go hand in hand. Unplanned pregnancies can increase the risk for violence, and violence can increase the risk for unplanned pregnancies. And this is why talking about this intersection is so important. And I feel like it's also a critical intersection to lift up, because there are so many gender-based violence organizations for whom, you know, this is an issue, but we should be building more and more with them, and really building power, because this impacts women and folks who face intimate partner violence in so many ways. And now, of course, with the end of Roe, this gray area that we're in, the confusion about what is and isn't legal across the country, we're seeing abusive partners using misinformation about the state of abortion access to pressure survivors and influence their decision-making, especially for immigrant women and people who work multiple jobs to put food on the table and make ends meet. There may be a lack of awareness about changing laws amidst the more pressing problems that they face on a day-to-day. And there can also be, of course, alienation from resources. So it's imperative that we educate our communities and make sure we get to those who are least likely to know where to go for help, because reproductive autonomy is a lifeline, and it's a chance to break free from the cycle of violence. I also want to be clear that attacks on abortion are not just attacks on abortion. I very firmly believe that. They're part of a web of efforts used to keep the social groups with power in power. Forced pregnancy is about controlling the freedom and social mobility of working class people of all races, of women, of people of color, of immigrants, and others of us whose freedom would threaten the status quo. It's not a coincidence that Dobbs comes at the time of heightened racist rhetoric and attacks on both critical race theory and transgender youth, and as you just heard, affirmative action. Abortion restrictions are meant to keep people powerless and in their place. Abortion bans are racial violence, abortion bans are gender-based violence, and abortion bans are class warfare. Thank you so much for this space today, and I'm really looking forward to the rest of our discussion.
Thank you so much, Shavana, for lifting up those insights and intersections and the connections between abortion bans and power and all the isms. It simply just is the intersections of abortion care and abortion care access and gender-based violence just doesn't receive enough attention. So thank you for lifting that up. And of course, we'll bring you back at the end of the program for the Q&A for folks to ask more questions. Our next speaker is Sari Lee. Sari is I personally think a rock star, but also a community organizer, a movement worker, and advocate for the AAPI and LGBTQ+ communities. In 2022, Sari received the Chicago Foundation for Women's Vanguard Award, which honors young leaders for their work in improving the lives of young women and girls. Sari is also the National Campaign and Membership Director for NAPAWF. And at this time, I want to say thank you for joining us, Sari. Well, let me just turn it over to you to talk about the importance of voting and GOTV efforts in the fight for abortion rights, as next year will be a big year.
Yeah, for sure. Hi, everyone. It's an honor to be speaking on this panel with all these amazing leaders and with all of you about the current state of repro access and the ongoing work that needs to be done. So since Dobbs, every state has taken action on abortion in some way. I'm just going to highlight a few of them, particularly the states that NAPAWF is working in on the ground. So in Florida, the 15-week abortion ban has been in effect since July 2022. No injunction has been granted and litigation is still ongoing. During the most recent legislative session, HB 7 and its companion bill, SB 300, both of which are a 6-week abortion ban, and also includes a ban on telemedicine for medication abortion and mailing abortion pills. That ban was passed and signed into law. However, it is not in effect yet, as we're currently waiting for the Florida Supreme Court to take action on the 15-week abortion ban. In Texas, post-Dobbs, we had a trigger law, a total abortion ban that's been in effect since August 2022. Providers have stopped performing abortions, pivoting to providing practical support so pregnant Texans can seek abortions elsewhere and get other repro care. In this past leg, HB 2690 was introduced in the midst of the FDA case, the medication abortion case. Unfortunately, didn't move. It banned distributing medication abortion or information about medication abortion. It also explicitly called for abortion funds to be investigated and prosecuted. In addition, we saw attacks on prosecutorial discretion, which were introduced, but again, didn't move, primarily in response to liberal prosecutors making statements or taking action in support of abortion access. Elected officials have been trying to limit prosecutorial discretion. So this looks like, for example, the removal of DAs who don't prosecute abortion-related charges or on other issues in violation of state law. So in response from our movement, we saw a lot of cross-movement building. So in Texas, we saw criminal justice, civil rights, labor, and voting rights organizations coming together, along with repro rights organizations, working with local officials to challenge these dangerous, unnecessary, and anti-democratic attacks. This has been the first session in a while that didn't center abortion, and instead there was more focus on LGBTQIA plus rights, including laws that were passed in Texas, as well as Florida and Georgia, banning some or all gender affirming care. So we also saw LGBTQIA plus and repro organizations working together to fight these attacks. In general, there's been an overall shift in restrictive states like Florida and Texas to attacking 1, prosecutorial discretion, 2, medication abortion access, 3, ability for residents to travel across state borders to access care, and abortion providers and funds in general, as well as the overall increased restrictions on access to abortion and contraception. And at the same time, as our other panelists have noted, there have been attacks on all our other rights, including voting and LGBTQIA plus rights. Going to Georgia, Georgia also had a trigger law, a 6-week abortion ban, HB 481, and an injunction was granted by a lower court temporarily, but then the Georgia Supreme Court granted an emergency stay. So unfortunately, it's still in effect while we're waiting for state appeal. However, at the same time, we've seen proactive bills too, such as the Georgia Reproductive Freedom Act, SB 15 and HB 75, which both were introduced but didn't move in this past legislative session. However, the RFA would have codified abortion into law in Georgia. It would have repealed the 6-week abortion ban, affirmed that every individual who becomes pregnant has the right to choose to continue their pregnancy or have an abortion, prevent individuals from being criminalized for pregnancy loss, and protect them against potential aggressive state or local prosecutors, and then finally extend access to abortion care for those in rural areas. Shifting to Illinois, HB 4664 passed and signed into law earlier this year. This was a reproductive rights and gender affirming care omnibus bill that protects healthcare providers and their patients from legal attacks by neighboring states and expands healthcare access and options across the state of Illinois. It also protects individuals from civil and criminal discovery from other states, expands access to reproductive healthcare by broadening the scope, and guarantees that abortion medications and gender-affirming care be covered by insurance at no extra cost to consumers, and requires local government employers to offer insurance plans that provide coverage for these treatments as well as for birth control. And then finally, in New York, lawmakers expanded access to medication abortion on state colleges and university campuses and made contraceptives accessible over the counter. So 1 year after Dobbs, 1 in 3 people across the country have lost access to abortion in their home state. And more than a quarter of Asian American and Pacific Islander women ages 15 to 49 live in the 26 states that ban abortion or abortion is severely restricted, including Florida, Texas, and Georgia. In particular, the majority of Burmese women have been affected. Indian women are the largest community of Asian American women impacted. And then approximately 1/3 or more of Tongan and other Pacific Islander women listed live in these 26 states. So kind of just bringing this all together, I really want to focus in on like some of these trends that we're seeing from the past legislative session and in the past year. And in particular, the attacks on prosecutorial discretion illustrate the intersectionality of our issues and the need for us to organize our communities and build a powerful voter base. They highlight the threats to the separation of powers, as well as the increased importance and urgency for cross-movement building to move progressive issues forward and strengthen a politically educated voter base. As we know, mobilizing and advocacy won't build us the power that we need to win significant policy victories and structural change. We also really need to organize our communities, as all our panelists have said. So repro, LGBTQIA+, racial justice, immigrant justice, labor, and voting rights organizations across the progressive movement need to out-organize our very well-organized opposition. And we're already seeing this happening, and this has happened, especially in some of those more hostile states like Florida, Texas, and Georgia. Last year, I wrote an op-ed called "The Fight for Abortion Rights is at the Ballot Box." And in that article, I argued that AAPIs can play a decisive role in this fight, as we are the fastest growing segment of eligible voters out of the major racial and ethnic groups in the US. And we're also strong supporters of abortion rights and access. For example, according to polling conducted by Asian Texans for Justice, 77% of AAPIs in Texas are in favor of legalizing abortion. So tackling the barriers that keep AAPI voters from the ballot box is essential to combating abortion restrictions. In 2023, NAPAWF has been digging deeper into local organizing, especially in Texas and Florida, and municipal elections in both of the states, as well as in Georgia, doing year-round voter education. Working with a diverse group of local partners and leaders, we were able to decriminalize abortion in St. Petersburg, Florida, and Houston, Texas. We are replicating those efforts. In both cities, we are integrating our local campaign work on the, integrating our local campaign work with our year-round voter engagement work. And this looks like educating voters on their rights and the importance of voting in all elections, including the municipal elections happening this year in cities and in those states, as well as connecting with them on the issues that matter to them, which overwhelmingly have been access to healthcare, especially repro healthcare, and bringing them into our local campaigns. Thank you, everyone.
Thank you so much, Sari. And obviously from Sari's comments, the fight for abortion rights at the ballot box is a key part of this entire discussion, and obviously should involve the entire movement to organize against the attacks happening. So for our attendees, Sari is sadly unable to stay on for the Q&A, but if there are any specific questions for them, particularly from media, we can connect you after today's briefing. So thank you, Sari. Our last speaker is May Thatch, NAPAWF's Florida organizing manager. May is very passionate about social change and dedicated to building power with AAPI women and girls in Florida. Welcome, May. So your question is, so you've been working on the ground to help push back against Florida's restrictions on abortion. Can you share more about what you are seeing in Florida and the work you've been taking part in at the local level?
Yeah, hi everyone. Thank you again so much for joining us this afternoon. So again, thank you, Isra, for the question. As you've all seen, I feel like on media, we only hear the really terrible things about Florida, right? They are happening, but I also want to highlight the good that's also happening in our state as well. And to let people know that, you know, there are great people fighting back every single day to make sure that this is an equitable Florida for all. So for us here at NAPAWF, as Sari mentioned a little bit about it, earlier this year, we were part of a local campaign here in St. Petersburg. So we worked with our St. Petersburg City Council members to push for a resolution to decriminalize abortion. So the resolution itself is saying that the city of St. Petersburg won't expense any local funds to criminalize anyone who is assessing this healthcare service. And so with that, we were able to talk to our council members. We got our members to take on stories and share their stories at city council meetings. We had them also do letter campaigns to our council members to let them hear how this affects our lives and how this affects our communities. We've mentioned it before, there's already compounding factors that affect the lack of access to this healthcare service for our communities, such as language access. So like the idea that we're going to add another layer of criminalizing someone who finally has the opportunity to access this healthcare is just another additional barrier. And speaking of barriers, this past legislative session in Florida, we did pass a 6-week abortion ban, which is, as much as we love to put like these timeframes, we all know that this is just a total ban, right? Like 6 weeks, most people don't even realize that they are pregnant. So like, when would you even start your time to even know you need to access services? And so for us, that has been obviously very detrimental to the movement here in Florida. But again, to show folks that, you know, all the movement that we've seen is that no one comes down to like save us. It's going to be us that saves ourselves. And that's really ringing true again to Floridians here. We're fighting for equal access and equitable access for all. So right now, us, NAPAWF, and we join other reproductive justice advocates and co-conspirators, and we're working on a ballot initiative. So this ballot initiative is happening. We started in May, so it's just launched for about a month now. The ballot initiative is to protect and codify abortion access and reproductive health care services for all Floridians in our Constitution, our Florida Constitution. So the ballot initiative needs about close to almost 1 million petition signers, but we've only launched last month, like I said, and we've already had over 250,000 petitioners. And so, like, again, to remind people is that what we're fighting for is not unpopular. Like, what we're fighting for are popular issues that everyone cares about, and most people want it to happen, right? People want to protect abortion care. People want equal access to education. People want to be able to talk about their identities in the classroom and anywhere else that they would like to, right? Like, these are issues that we all care about and we all are fighting for. And we have to remind ourselves that we're fighting for the majority. It might be that right now, what it seems like, it's the majority doesn't want these things, but we know that's not true because we've seen polling before and we've heard of statistics before that these issues that we're fighting for are something that everyone wants to make happen. And so for us here in Florida, I want that message out as well, that like Floridians here are fighting against the divisive and oppressive issues that have been passed, or like the laws have been passed. And July 1st, this weekend, will be the mark of where most of the laws that were most of the bills that were passed this weekend, this last legislative session will come into effect. And so our communities are gathering statewide to, stand up and let our community know that we're here to support them, and to let our legislatures know that we're not going to sit here and let them just take away our rights, that we're fighting back. We're letting them know that we're here, and whether they like it or not, we're still going to keep fighting. We're still going to make sure that everyone here is taken care of, and that we are going to be the ones to save ourselves.
Thank you so much, May, for sharing your reflections from the ground, but also sharing more about the ballot initiative that you're working on. And obviously, I don't need to say this, but we're so appreciative and proud of the work you do, that I know that it's not easy during these times. So thank you very much. All right, so at this time, I'd like to welcome back Mimi, Jen, and Shavana back to the screen for the Q&A section of this program. So if you haven't done so already, please add any questions you have to the Q&A window. And I will get us started off with the first question, which is, we did address this a little bit, and I think in a few of our speaking comments, but would love to know, can you talk about the issue of abortion access in the context of next year's election? Do you think it will motivate voters?
I'm happy to start. Yes. There's been poll after poll after poll around the Dobbs anniversary, everything from USA Today to Gallup, not just our organizations like NARAL and our polling, but independent ABC News, NBC News, showing that the abortion issue is more salient than ever. And look, the longer these bans are in place and the more horror stories are penetrating the mainstream press, the more public opinion continues to be shaped pro-abortion access. The more Americans are understanding that abortion is necessary health care, and the more disinfo and bad mythology about what abortion looks like are getting debunked by the week. And it's not by just our activist organizations, it's by the mainstream press. Because, ultimately, as we've always said, abortion bans create this utter chaos and disenfranchise everyone, including white women. Let's be clear. It's not. So when you're finally losing rights as white women, it starts to penetrate, right, to a more mainstream audience. That being said, I also want to share that, all the campaigns are focused entirely on reproductive rights. We expect the Biden-Harris re-election campaign to be very focused on abortion access. And we know that Senate Democrats and House Democrats are running on restoring Roe. I think the challenge is going to be for our movement, making sure our policymakers understand that while that's a mainstream campaign position and they should keep it at the forefront, abortion justice in this country means much more than just restoring Roe. So we are on a pathway for increment, and I think it's going to have to be an incremental approach, meeting voters and elected officials where they are, but also pushing for as much as we can get. And a lot of that important work is going to happen in the states and in these state elections, where you've got places like Michigan, but also New York and California that are going to expand access in really remarkable ways, probably faster and more boldly than what we're going to see at the federal level. So it's going to be first and foremost, there's a ton of opportunity for us. But we've got to keep the pedal on the gas, if you will, right? We can't let the extremists distract Americans or continue to peddle misinformation to our diverse communities, frankly, right? That confuses folks about the issues at hand.
I can just add a little bit to that. There was supposed to be this red wave in 2022, and that red wave crashed into the Dobbs decision and didn't do what conservatives had hoped it would. And so I feel like that's also a good indicator of what the next set of elections are going to look like as well. What I am interested in seeing, and I think we have an imperative to work on, is what happens in blue states like where I am, New York or California, where folks feel folks who are not paying attention feel like they are not impacted. And while they may be outraged about what's going on across the country and even pay, attention to the news, they may not understand that even states like New York are not going far enough, right? So Governor Hochul just passed a bill through which does a lot of good things, but doesn't fund abortion funds and folks who are doing work to help people get to where they need to go, right? The networks that are not clinical and that are not hospitals. And, one of my old colleagues and a kind of celebrity in the reproductive rights movement, Jennifer Gonzalez Rojas, was one of the elected officials that proposed that. And I feel like that is a good showing of how even in what we consider the most progressive states, folks are not going far enough. And people who organizations like mine have access to need to be aware of this and need to be making noise and need to be pushing for everything and anything to be done, because people need more options than ever right now.
I'm also going to jump in on this question, if that's okay, and just add that in the context of next year's election, what I really hope is going to happen is that with the election cycle coming up, there's often a spotlight on the Asian American electorate and conversation from different campaigns about different issues that affect AAPI communities. And what I hope I'm going to see next year is a increased conversation around this intersection of reproductive justice and the AAPI community, which I hope will have an immediate impact during the election to sort of spotlight that issue, but also more broadly to normalize conversations about reproductive justice within the AAPI advocacy community.
Thank you so much. And I think our next question is a little bit dovetailed with this. And so the question is, fighting state by state is exhausting. Agreed. So how can we move federal politics to expand the Supreme Court and or codify Roe through Congress?
I can take that. Isra, can you repeat? I'm sorry, I got distracted.
No,
State and codify federally?
Yeah, any thoughts on that? Obviously, I view this question as a both and, right? We have to fight at the state level. We also have to fight at the federal level. So any thoughts on how we can move federal politics to expand the Supreme Court and or codify Roe through Congress?
Yeah, so expanding the Supreme Court, I think Isra, correct me if I'm wrong, I believe NAPAWF is also on board with the on expanding the court. Expanding the court is and providing more guardrails and ethics like guidelines from Congress. Congress can regulate the court, is a longer term play. It's not going to happen overnight. We don't even have all the Democrats with us in expand the court, but we're starting the critical work now. So that we can hopefully be a few cycles away from serious action by Senate Democrats and Congress on the courts. I will say Senate Judiciary is feeling a lot of pressure to enact more strict ethics reform, which is a nice first step, but we're probably a few cycles away from court expansion. I'm just being pragmatic. Codifying Roe, we are probably, here's the challenge. There's 11 Democratic senators who support, most who support codification of Roe, with the exception of Joe Manchin. Most who support eliminating the filibuster to do so, exception being Manchin and Sinema, up for re-election. So the challenge is going to be winning back the House, holding the Senate, ideally adding another pro-choice, pro-filibuster reform senator before we can even do the baseline of codifying Roe. That being said, it's not impossible. It is very possible, to the point that Shavana made about the expectations about 2022 and the red wave. Folks think 2024 will also be a tough year for Democrats, but look, with abortion access and abortion rights, with the political salience that they have, there's going to be a mandate. And we'll work really hard at collectively at making sure we get pro-choice majorities. What I will say is the states that have some of the most critical bans where we have to fight to codify and expand access happen to line up very nicely with some of these Senate races and these ballot initiatives and the congressional map. So whether it's, I know this is a C3 call, the organizing work we're going to do to mobilize our communities to be educated and engaged is going to be critical in the states that we're already in, and it will ladder up to the work we have to do at the federal level. I hope that helps.
Well, it helps me. It gives me a sense of optimism too. So thank you for that. So I'm going to go to our last question because we're at time. And this one probably Shavana might be best poised to answer, but obviously welcome thoughts from the group. So earlier this year in April, the Supreme Court issued an interim ruling blocking a decision by a federal judge in Texas that invalidated FDA approval of the abortion pill mifepristone. That case is still winding its way through the appeals process, and it is expected to be back before the Supreme Court. Can you offer your insights into the importance of self-managed abortion post-Dobbs?
Sure. Yeah. I mean, one of the things that I've been seeing as a blessing post-Dobbs is the existence of a medication abortion, which has been safely and effectively used for over 20 years now. And then we saw this case come up through the courts. And if the Texas ruling takes effect, 40 million people would be losing access to that medication abortion. And of course, it's especially distressing because post-Dobbs, even before Dobbs, frankly, but more so now, people have got to travel very, very far distances for abortion care. And so self-managed abortion through pills, medication abortion, can help alleviate that barrier of travel and the very, very high costs of abortion because of travel, right? I've heard stories of abortions costing upwards of $20,000, right? Because of the travel incurred costs. And I would be remiss too if I didn't share that, medication abortion is safe and it is effective. I feel like I can and should keep saying that over and over because not very many people are aware of it. And, studies have shown it to be safer than Tylenol, penicillin, and even childbirth. And, the risk of death by taking Viagra is nearly 10 times greater, according to the FDA, right? So we have to remember that this is something that is safe and has been used for a very long time. And medication abortion also increases access, right? Because it can be managed by us. We can essentially do this on our own, which is recognized as an important abortion access method by the World Health Organizations. We don't need to rely on doctors or clinicians, of which there are becoming less and less, right? Especially post-Dobbs. So with the right information and guidance, this can be done with no outside medical support. So, if we're talking about self-managed abortion today, for the most part, you're talking about pills, and the greatest risk of self-managing your abortion is really arrest and criminalization. It's not medical safety. And with these pills, we can have abortions literally in our own hands, on our own terms, in the privacy and comfort of our own homes, which is a blessing for low-income people, for people in rural areas, and for undocumented immigrants, right? Who have an added travel barrier because they don't want to be interacting with law enforcement. So it's something that we need to be raising awareness about, growing access to, and we need to make sure that it's not criminalized.
I just also wanted to jump in on this issue and really highlight how this is an issue that impacts the AAPI community in particular. I think NAPAWF actually put out a study recently talking about the misinformation and disinformation issues that are prevalent around access to this kind of abortion care within the AAPI community. I think that's like broadly true also just outside of our community, but it is also something that in particular also challenges us. And it also is lack of access to this greatly impacts many of our most marginalized community members. I had mentioned earlier Guam, for example, and for folks who live in Guam, there are no clinics on the island. And so this is the only kind of service that is available. And so if it's not available, the only way to access these kinds of services is an 8-hour airplane flight to Hawaii. And so when we talk about this issue, I think this is an area in particular where we can talk about the impacts on our community.
Yeah, and thank you so much for bringing that up. So here in Florida, like we said, right, we're figuring out how do we expand access to when our access is getting taken away with a 6-week abortion ban, right? So here in the chapter, we're going to be hosting an event, both a hybrid event, virtual and in person, to talk more about the study that we just recently released in regards to how our community feels and knows about a medication abortion and what they need to know in order to self-manage as well. And then for us, we also know just as important is that our youth also needs to know this. And so we're also going to be hosting another event with college students here for API college students at one of our campuses in Tampa at USF to also inform them of this medication abortion and the safety of it, and also like our research, and hopefully open up this dialogue and this conversation to make sure that our communities are informed and engaged and know like what access are available to them.
Thank you so much, May and Minnie and Jen and Shavana and Sari, who couldn't join us for the Q&A. Really appreciate you taking your time out of the day to just reflect on, you know, where we were, now where we are, and where we're going. So thank you again, and we'll see you next time. So on behalf of NAPAWF and our guests today, thank you for joining us. To stay up to date on these and future events, as well as the changing landscape of abortion access and reproductive justice, please sign up for our mailing list by visiting napawf.org. You can also follow us on our social media channels. Thank you again for taking part in today's community briefing. Take care, be well, and we will see you soon.